Hello, I'm going to talk today on vitamin C, cancer, and heart disease, and the important ways in which these things coordinate, integrate, and affect each other. In this presentation, you might see from time to time numbers following a certain statement or assertion, and that's a PubMed reference number, PMID, that can allow you to go to the area on PubMed that gives you a scientific documentation for the particular statement in question. Now, I like to start all of my presentations by giving you an overview, so you have the eagle's view vision of where we're going and how we're going to get there. So to start with, I'm give a brief rundown on redox, reduction, oxidation biology, and truly the nature of all disease. Then I'm going to follow it with specific information on the incredibly vital role in disease played by all toxins and countered by quality antioxidants and nutrients. Then I'll go into a good overview and documentation of the incredible importance of vitamin C, truly as the master molecule in your body, truth be known, because it makes sure the electrons that biomolecules need receive them, and the role that it's already been documented to play in controlling and often resolving all variety of diseases, especially infectious. Then I'll give you a reason and a overview as to why pathogens, infectious agents, are a contributing or primary factor in nearly all disease. And then I'll end up with these 2 points that I think are important for individuals who are interested in utilizing this information to establish protocols in clinics, etc. I'm going to outline for you the, to me, incredible but consistent interrelationship between pathogens, toxins, inflammation, and virtually all coronary artery disease, those things that cause myocardial infarctions and heart attacks. And then I'll show you a similar reason why you have this same interrelationship with nearly all breast cancers. As far as redox biology goes, in fact, and I mentioned the importance of vitamin C, the essence of redox biology is really the essence of vitamin C-based biochemistry. Now, 2 very important definitions here, and I say this because when you look in the literature, you'll see a lot of these different phrases, labels put down there, and they never really tell you this, but it's important to realize that, as I'm going to show you, especially in the case of toxins, they all mean the same thing. So when it comes to a pro-oxidant, something that takes electrons away from molecules and leaves them electron depleted, you have a toxic pro-oxidant, and this is also called just a toxin, free radical, a reactive oxygen species, or even more generically, if you will, a poison. Anything that poisons you that's toxic is going to take or cause to be taken electrons away from normal, also called reduced, biomolecules, and this leaves the biomolecules in an oxidized state, an electron depleted state. But very importantly, you see the underlying part. A toxin not only takes the electrons away from biomolecules, it never releases them again. So it takes those electrons out of shape, out of circulation, and depletes the available electron pool. And I'm going to show you how the electron pool and electron flow current is the essence of biochemical interactions and the essence of literally life in all biological species. Then I'm going to tell you about the definition of an antioxidant, and quite simply, an antioxidant, of which vitamin C is most vital, and I'll show you the reasons for that in a moment. Vitamin C gives or restores electrons back to oxidized biomolecules. It's basically the delivery mechanism for electrons. You can have all the electrons in the world and a good quality diet, but if you don't have enough vitamin C, along with other quality antioxidants, you're not going to get them distributed throughout the body and the cells where they're needed. Now, so put in other terms then, vitamin C has a reductive nature. it brings electrons back to cells, and the pro-oxidant nature of toxins. This allows a very simple but completely accurate explanation as to why vitamin C, along with other antioxidants, is truly the ultimate antitoxin. Because the only way a toxin is toxic is by oxidation. So if you have something that can either prevent that oxidation by giving an electron to a toxin before it reaches the biomolecules, or after the fact, after the toxin has done its damage and taken electrons away, the vitamin C or other quality antioxidant can come along and restore those electrons there. So you have the ability of something like vitamin C, very importantly, to counteract toxicity by either or reducing the toxin or reducing the oxidized biomolecule that the toxin caused. And importantly, here on the bottom line, it's important to realize properly administered vitamin C has never failed to neutralize an acute toxin exposure or ingestion. It's really that simple. It doesn't matter what the toxin is. And yes, I know there's thousands upon thousands, even more of toxins, and yet just a quality antioxidant like vitamin C can neutralize the toxin directly or repair the damage that it did to a biological system and biomolecules. Now, this is very important, and this might be something you've never heard of before. In the literature, you take any disease that you want, type that name in PubMed, and then type in the phrase oxidative stress. And you will see that every disease has an association with oxidative stress in PubMed. And the authors will nearly always use this to conclude that means oxidative stress causes disease. Well, it seems like a small point, but it's an important point. The oxidative stress, the increased numbers of oxidized biomolecules, doesn't cause some other disease. It is the disease itself. The fact that you've oxidized biomolecules and basically inactivated them so they can no longer perform their natural biological function, they become non-players. And the more you oxidize biomolecules, the more they physically accumulate and block or lessen the ability of other reduced biomolecules to have their appropriate interactions. So increased numbers of biomolecules, different places, different locations, different concentrations, that is disease, okay? Biomolecules, what I mean, nucleic acid, proteins, enzymes, sugars, fats, all of these molecules that play a role in biological metabolism. And as I said, they're inactive when they're oxidized and active once again when you reduce them. I mentioned this, let me outline it for you then. What disease you have depends, as I said, on having oxidized biomolecules, but the disease itself, because we have many different diseases, it depends on the type of biomolecule oxidized, how long have the biomolecules been oxidized, acutely or chronically, where are they located, intracellular, extracellular, a certain tissue, to what degree does a certain species of biomolecules is it oxidized, and also remaining function. And this applies primarily to large biomolecules like enzymes. You might oxidize part of the enzyme and not completely neutralize it, but decrease its biological activity by a percentage, 10%, 20%, 50%, etc. And these different characteristics of oxidized biomolecules are dictated by the biochemical characteristic of the toxin or toxins that caused it. And these are some of the more significant properties of a toxin that dictate the variation of biomolecules that are oxidized to present as a certain disease, and that's solubility. Some are fat soluble, water soluble, some are even soluble in both environments. The molecular size, something very tiny molecule gets everywhere much more easily. Larger molecules are limited in the areas inside the cell and inside the extracellular spaces as to where they can go. Some are ionically charged or electrically neutral. This strongly affects where they can go. Some have a unique biomolecular structure or molecular structure, and they physically fit, and how readily they oxidize something, chemical compatibility, they need to be able to meet and touch, if you will, in order for this oxidation reduction state to take place. And finally, how readily is it accumulated or excreted? Fat-soluble toxins tend to stay in the body a whole lot longer and accumulate, whereas not all, but many water-soluble toxins come in, do their damage, and then present themselves once again to the extracellular space, through the lymph, and into the bloodstream so that they get excreted. All these are factors that play into this type of scenario. So, important to realize that a toxin takes an electron, never surrenders it again, and this depletes or lessens, knocks down the available electron pool in the cell. And as I said, cells and all biological systems require some degree of current, and current is just electron flow. And if you continue to take electrons out, the currents are much weaker and the cell is much less healthy or even unhealthy. Those are bottom two lines there. Antioxidants promote cellular microcurrents, toxins inhibit it because of this effect on electron flow in the cell. Also, once you have healthy currents inside the cell, you might recall from your physics training that electron flow generates appropriately voltages. And so depending on how much current you have flowing in the cell, dictates how healthy and normal the voltage is across the cell wall. Now, a great misconception, and I think it's important to understand it, is that for the longest time, really until the last year or so, it's been, and still many people think this, they don't realize this. This is important information for you to realize. It's, I don't think, available at this point in time in other sources, is that vitamin C does not serve primarily to bring new electrons into the body. It serves as an electron distributor. And this is important because we know through experiments like this one, where they induced stroke in animal studies, and they showed that oxidized, electron depleted vitamin C, dehydroascorbic acid or DHAA, still readily minimized brain infarct size and helped heal the situation, something you would expect from a antioxidant function, a electron contributing function. Well, the vitamin C does contribute the electrons, but only after it picks them up from what was supplied to you in your diet. Similarly, and this is very important, in case you don't know, methylene blue is a very, very, very wonderful agent for just about everything, because it's another potent antioxidant, a small molecule that gets throughout the body very quickly, and has been documented to even resolve by itself conditions as severe as advanced septic shock. And it's done this as a monotherapy. Well, look at this about vitamin C. And vitamin C has had a lot of studies showing, only really been studied in its reduced form. But there's a few studies that I showed you that shows it's very good in its oxidized form. Well, methylene blue, in its blue form, in the way you take it and the way it's supplied, is in a completely electron depleted state. Methylene blue, when it's blue, is oxidized, and it's only when you bring electrons in that you turn the methylene blue and make it clear, called leucomethylene blue. The point being, though, I want to re-emphasize, quality antioxidants do an equally good job in resolving a situation of increased oxidative stress inside the body, whether they're given in their oxidized or their reduced form. It's like a company that makes widgets. The widgets in this case are electrons. So you're bringing in new electrons with your diet, or the company is making new widgets, but they're of no value if they don't get distributed. So how many distribution trucks are there? Only 2 or 3 trucks? Or are there a couple thousand? That's where the vitamin C and the quality antioxidants come in. They go to make sure the electrons that you get from a quality diet are distributed. Any electrons you get from just the reduced form of vitamin C or another antioxidant is largely inconsequential compared to the electron pool that you supply coming in from quality nutrition. Vitamin K2 is another example. It's supplied in a routinely given in its oxidized state called menaquinone, but menaquinol is its reduced state. Also, it's not here, but another one, coenzyme Q10, ubiquinol and ubiquinone, reduced and oxidized. Both of those forms are marketed as supplements, and both are highly effective. But again, this is not really realized yet. Perhaps in the future, we'll see supplement companies not be completely fixated on giving the oxidized form of a supplement if it's antioxidant, and realize that whatever form is easiest to produce can be the one that's sold, because they both work equally well. The importance of vitamin C. They have a test called the ORAC test, oxygen radical absorption capacity. Basically, it's just, I can't give you a sophisticated explanation, except that it's a measure of how quickly and easily an antioxidant gives up its electron, able to cause a reduction in something that's oxidized. And they have silly stuff out there. It might be technically accurate on this test where they say things like astaxanthin, a fat soluble, not water soluble, that's good for the eyes and the fatty tissues. They say it's 6,000-fold more potent than vitamin C. Well, guess what? There doesn't exist a deficiency syndrome called from not having enough astaxanthin. If you don't have enough vitamin C, you die from a syndrome called scurvy. So it's clear that just the ability to release the electron is not the primary measure of an antioxidant's value. Vitamin C is uniquely powerful and valuable because of these factors. It's small and present in all cells. It uses the existing glucose transporters assisted by insulin, usually in competition with glucose, to get inside the cell. There are other active vitamin C transporters that can bring vitamin C into the cell. And it has easy access once inside the cell to all the different intracellular compartments. Also, interestingly enough, it can move 2 electrons per molecule rather than 1, giving it a doubly efficient ability in that regard. It also has a stable 1 electron depleted intermediate state called the ascorbyl radical. And this is an amazingly stable entity, species, and it's able to adapt to the demands of the microenvironment, be it oxidation or reduction. And of course, as I mentioned, if you don't take vitamin C, you die of scurvy. All right, so a basic rundown then of these laws that I put together of redox biology. Number 1, electrons are the fuel of life, and the quote-unquote combustion of this fuel is really nothing more than the flow of electrons between and among biomolecules, which generates intracellular microcurrents. Number 2, all increased oxidative stress results in electron depletion and inhibition of electron flow. Number 3, all toxic effects. If science tells you something is bad for you and is a toxin, then by definition, it's oxidizing biomolecules. If it doesn't oxidize a biomolecule, it's not a toxin. And then finally, perhaps most significantly, increased oxidative stress or disease itself is increased oxidized biomolecules, not caused by them, but the disease that you're looking at is a unique array of oxidized biomolecules. Now I'm going to go, not going to dwell a long time, but I want everyone listening to this presentation to realize what already exists in the literature on vitamin C. Dr. Klenner was the pioneer on this way long ago, recently, well, not that recently, died in 1984, but did a lot of work in the 40s and 50s, published 28 papers documenting much of what I'm going to go through. Now, what pathogens has vitamin C already been proven to cure or kill or resolve? All viruses in vitro, poliovirus specifically, herpes, vaccinia, enteroviruses, influenza, rabies. This is not a comprehensive list. This is an exemplary list. I really can't tell you of any virus of which I know or which I've read that vitamin C cannot completely resolve and cure in terms of neutralization in the test tube or killing, resolving the virus as an infection in the body. And in fact, we have the evidence where it's cured polio, 60 out of 60 cases, by a combination of injected and oral vitamin C only, just those two things. And even in cases of advanced polio and the associated flaccid paralysis, where these babies and youngsters start getting paralysis in their limbs that they got put in a long time ago in the iron lung, this can often resolve that paralysis and that flaccid nature after it's already been developed by giving and persisting with the vitamin C therapy. So Klenner even found that high dose vitamin C just orally was able to resolve polio quite well. And even when you use lower doses, you still resolve it. It just takes a longer period of time. What pathogens has vitamin C already proven to cure? Non-viral infections, diphtheria, tetanus, staphylococcus, streptococcus, pseudomonas. These are all classically recalcitrant and difficult infections to resolve. Yet if you aim the trigger with enough vitamin C, you will resolve them virtually every time, unless you have a severely ill patient with other complicating factors and they're close to dying when you start the therapy. Also, measles, mumps, herpes, rabies. Now, I want to say rabies has not been resolved in the human because they've never done that type of research, but they have looked at guinea pigs, which is the perfect animal model with regard to vitamin C deficiency compared to the person. And very clearly, vitamin C resolves rabies in guinea pigs. Other things where vitamin C has been proven to help resolve, not reliably cure, but always help to resolve: malaria in very low doses, chronic, slower growing infections. And basically, the more slowly an infection grows, is going to be more and more resistant to any therapy, because most therapies that resolve an infection depend on how quickly the pathogen or agent is replicating. So leprosy, typhoid, dysentery, trypanosomes. Other things it's been clearly beneficial for, sometimes cures, but I'm not going to say it reliably cures: Lyme and AIDS, chronic hepatitis, not acute. It resolves acute hepatitis, especially viral, very quickly and very easily, even with very high enzyme levels. The common cold, it will attenuate it very well. Dr. Linus Pauling wrote a lot about this. Also tuberculosis, also pertussis or whooping cough. Now, those are all the infections. What has vitamin C already been proven to neutralize in terms of toxins? Now, I just told you the evidence shows that it neutralizes all toxins. However, there have been studies that show for sure it has done it on these toxins, toxic elements. Look at that list of elements: mercury, lead, chromium, arsenic, cadmium, nickel, vanadium, fluorine, aluminum. You don't want to be fluoridating anything. Venoms, snake and spider. Alcohol. I mean, it can detoxify alcohol. Don't want any drunk people getting out on the road because they took their vitamin C real quick and started feeling better, but vitamin C will get you out of an inebriation very quickly. Barbiturates, toxic mushrooms, pesticides, strychnine, tetanus, the list goes on and on. Also, all toxicity, all increased oxidative stress is not caused by a physical agent. Radiation toxicity is only toxic because the radiation ultimately receives in the release or a theft, if you will, of electrons away from the agent. So you can neutralize this with enough antioxidants. It's just that when you have somebody that has a severe radiation poisoning, they might not respond because there's already been too much damage and too many biomolecules for whatever dose of vitamin C you can get. But if somebody's in moderate shape, you're going to pull them out of radiation toxicity just as well and just as quickly as if they've been poisoned with any physical agent. So let's look at an important concept to keep in mind, not only the rest of this presentation, but I would suggest for the duration of your clinical practice, is that the proper aim of any clinical protocol must be to normalize or optimize vitamin C levels inside the cell. And you see the statement there, and I guarantee it's correct. If you have and can obtain or attain a normal cellular vitamin C level, you have a normal cell. Now, I'm not saying it's easy to do that. There's a lot of different factors that are going to knock that vitamin C down level and keep the cell sick. But if you're able to put together a protocol that can bring up and keep vitamin C levels inside the cell at a normal level, you've got a normal cell regardless. Whether it's cancer, whether it's infection, whether it's any disease you can imagine. Now, and Dr. Honeyhackey is going to be talking about some of these things on the administration of vitamin C, so I'm going to give you a quick rundown of not only how to give vitamin C, but the reason why different things and the way you administer it also affect the clinical response that you get. The main factors in the effective administration are dose, the route, how you give it, how quickly you give it, rapidly, how often you give it, frequency, how long your total treatment protocol is, what type, there are different types of vitamin C, and what other therapies are you taking with the vitamin C, adjunct therapies. Almost all clinical failures of vitamin C are you didn't give enough, or enough did not get to the target area inside the body. A lot of docs, good docs out there, will use 10, 15, 20 grams of vitamin C, but for some reason they're just gun shy and they're never willing to go up to 50 to 100 grams, which is sometimes what's needed. So it's like, what are the three most important factors in real estate? Location, location, location. And I like to point out, what are the three most important factors in French cooking? Butter, butter, and butter. And then along those lines, what are the three most important factors in vitamin C effectiveness in whatever you're treating? And that's dose, dose, and dose. Vitamin C can be given very effectively orally, encapsulated in liposomes, a very important way to take it. It gets, like an artificial cell, gets a high dose inside the cells, even though you take it orally. Even gets it inside the cells more effective than intravenous, but intravenous is great. I don't want to in any way impugn intravenous vitamin C. It's a phenomenal therapy. But look at this bottom sentence here. And I have time limitations, so I can't give you all the pharmacology and biochemistry, but oral ascorbic acid with properly dosed hydrocortisone, that's cortisol. The adrenal gland makes cortisol primarily to push the vitamin C that's present inside the body into the cells. So when you take vitamin C in any form, including ascorbic acid, and you also take hydrocortisone, 5, 10, 15, 20 milligrams orally with it, you're going to get a profound additional push of vitamin C inside the cell and a much better clinical response on whatever you're treating. It can be given intramuscularly. This is what Dr. Klenner did, even with babies and small children. It can be given intramuscularly if you're just not able to, for whatever reason, deal with an IV. The oral liposome encapsulated is a form very readily absorbed, no stomach upset, and intracellular bioavailability. A lot of people, a lot of docs think bioavailability means getting into the blood. Well, bioavailability only means getting into the blood if your target molecule is in the blood. If your target molecules or target pathogen is inside a cell, that's where bioavailability is, getting it inside the cell. Also, liposomes don't consume energy, so you don't have to worry about using up ATP to get something inside the cell. Rate. This has a lot to do with how sick somebody is. You can give vitamin C very rapidly, or you can give it, if the patient is less ill, much more comfortably, if you will, or easily as a slower IV infusion. And yes, you can give an IV push. This is something, I'll read the whole thing for you. In a cyanotic, acutely poisoned patient, Dr. Klenner, who felt he was dying, Dr. Klenner wrote the following. This is a direct quote. 12 grams of vitamin C was pulled quickly into a 50 cc syringe and with a 20 gauge needle was given intravenously as fast as the plunger could be pushed. And even before the injection was completed, the patient exclaimed, "Thank God." That's how sick he was. That's how quickly he resolved. But don't be gun shy about giving vitamin C enough, rapidly enough, especially in critically ill situations. IV vitamin C. Vitamin C is a very similar molecule to glucose. And in animals, used to be in human beings, the liver would convert glucose into vitamin C with a 4-enzyme modification. So they're very similar molecules. Because of this, when you give a large dose of glucose into the body, what happens? You get a surge of insulin. Well, guess what? When you also give a large dose of vitamin C rapidly, the pancreas thinks it's glucose and also produces insulin. And this is important because they have something called insulin potentiation therapy, where they deliberately give insulin to drop the blood sugar so that things like chemotherapy, which I'm not in favor of particularly, and other nutrients can get inside the cells more easily, more readily. And at least in the case of chemotherapy, you give a lower dose because it's not needed. Well, giving vitamin C very rapidly gives you an endogenously induced form of insulin potentiation therapy, and you can get the blood sugars quite low. Frequency. In a nutshell, it's great to get 50 to 100 grams of vitamin C. It goes up and then down, and you can have very important positive effects at its peak concentration. But in terms of clinical impact, we've gotten to the point where we usually always give it as one dose because the patient is being seen in the clinic. And don't have the luxury of treating the patient over a 24-hour period as in a hospitalization. But I bring you to the bottom comment there. I would maintain the evidence shows and my experience shows that, for example, 100 grams given in 4 divided doses of 25 grams each, 25 grams every 6 hours, will give you better pathogen coverage and a more powerful clinical impact than if you gave all 100 grams quickly, and let's say a 50 to 60 to 70 minute period as a rapid IV. Duration, don't give up on vitamin C after the patient gets better. Continue it for at least 24 to 48 hours, or oftentimes, even though the patient responded well, you can get a quick relapse. So just stay with it until you're very clearly out of the woods and the patient, in this case, no longer has any evidence of infection. Type. The vitamin C is the ascorbate anion, the negative part of ascorbic acid, hydrogen ascorbate. You also have sodium, calcium, magnesium, potassium, manganese, zinc, molybdenum, chromium. All of these metals can attach to the ascorbic anion and give you a positive vitamin C impact. A vitamin C complex is just complete bunk, completely ridiculous. Vitamin C does work even more effectively if you give other good antioxidants, which you will see in the quote vitamin C complex, but they're not essential for getting the impact of vitamin C. But it's gone. They've even gone so far as to say ascorbic acid is not vitamin C. That's ridiculous. So ascorbic acid is a good form. Some people have a delicate stomach, in which case you give sodium ascorbate as your vitamin C. Calcium ascorbate, I advise never, because Nearly everybody has a calcium excess. It's actually excessive calcium inside every diseased cell that keeps the oxidative stress up. So obviously you want to get the oxidative stress down, and you'll never do that as long as you're taking extra unneeded intake of calcium, whether in food or in supplemental form. The other mineral ascorbates are good, but they make things needlessly expensive. And also, in order to take enough vitamin C, you might end up taking too much of the mineral. So take your mineral supplements separately, my recommendation, and take your vitamin C separately. It's important to understand that vitamin C really, because of relieving the oxidative stress, augments the impact of any other therapy that you take. Interestingly enough, although I don't think antibiotics are needed in most cases, I will say sometimes when you're taking already vitamin C, adding an antibiotic in a given situation can help resolve a situation more quickly where the pathogen in question is sensitive to that antibiotic. One of the reasons for this is that many antibiotics are iron chelators. So whatever else vitamin C is doing, you give the antibiotic, you pull out much of the pro-oxidant iron. Free iron is highly pro-oxidant, highly toxic. Chemotherapy is pro-oxidant toxic, and if they're taken simultaneous with vitamin C, the vitamin C can neutralize them. But directly before, directly after, as long as the chemo gets into the tissue, and again, I'm not recommending chemo, but a lot of people get chemo, and a way to increase chemo's positive effects, cancer cell death, and decrease the negative effects of oxidative stress and toxin effect on other normal cells, giving vitamin C with it is profoundly positive and profoundly effective. Dose, you do it on body size. This is a general rule of thumb here, but it's not etched in stone. You give what you need. Vitamin C is extremely, if not completely, non-toxic. When you give a lot of vitamin C quickly, if you have a lot of stored intracellular toxins, if you have a massive kill-off of pathogens that might be present, or a massive kill-off of susceptible cells, you release toxins into the blood, you release free iron into the blood, and the patient starts to feel bad. They're having a toxic release into the blood under these circumstances, and this is termed what's called a Herxheimer reaction. When this occurs, it's very good to slow or stop the vitamin C infusion, wait a few moments, few minutes, and then reinitiate the infusion at a low dose at a slow rate. This is an amazing situation in where the agent that caused the detox reaction is also the perfect treatment for the toxins that were released. So vitamin C is your ultimate antitoxin, but you gave so much of it so rapidly, it ended up in a lot of toxins being dumped into the blood. So you back off on the large amount of vitamin C and come back with a smaller amount that quickly neutralizes what's in the blood. And more importantly, perhaps, has the patient feeling well by the time they leave the office. If a patient feels awful following the office, they may not come back, and then they won't get the benefit of future infusions. So multi-C protocol, different forms of taking it. Liposome encapsulated, regular powder. You take a lot of powder, you get something called bowel tolerance. They have a fat-soluble form of vitamin C, ascorbyl palmitate. And you have intermittent IV administration of ascorbate, where you can have an infusion of vitamin C and then periodically give additional IV pushes on top of that infusion to periodically re-bump up the high ascorbate level that appears to be more effective in, say, killing cancer cells and even killing pathogens. You can give it intramuscularly, and then an important one there at the bottom, and I don't have time to go into a great deal of detail, but except to say that the genetic deficiency that keeps most people from making vitamin C is an epigenetic, meaning it's not programmed to the DNA, but it means the fourth enzyme in this case did not get transcribed or translated And so you didn't get this enzyme that finally makes the vitamin C. Well, we have agents that have been shown when you take them, they actually help reverse this deficiency and allow the person to start making more vitamin C of their own again. So, and in a nutshell, the agent that's been documented very well is hydroxytyrosol that comes from olive leaf extract, and also another polyphenol antioxidant called polycosanol. Now, a few words about vaccinations. The purpose of vaccinations supposedly is to provide an antigen-induced stimulation of antibody production. However, it's very important to realize this means also that vaccinations are always toxic. Doesn't matter what type it is, it's toxic by nature. So anytime you take a vaccination, you are by definition giving some degree, from minimal to sometimes massive degrees of toxin, which is really the entire reason why we have autism, why it's continued to rise, is we've had too much politics in the practice of medicine, fighting and defending vaccination tooth and nail, while we incapacitate untold numbers of babies and children. But I fully realize with the politics that sometimes parents absolutely, for one reason or another, cannot avoid getting supposedly the harmless childhood vaccinations. Well, they're not harmless, but if you take enough vitamin C before, during, and after, this could be virtually completely eliminated so that you can get whatever the purported benefit of the vaccine is and completely block any of the damage that the vaccine could have done by having powerful amounts of vitamin C present to deal with the oxidative stress induced by the vaccine toxin before it has its impact. And this is outlined in this article on my website, tomlevymd.com. There's a lot of articles out there on this and other subjects that you're more welcome to review. Now, this is something, of course, that Dr. Honeyhackey can address in much more detail, but I want to say that vitamin C is safe. It's probably about the safest thing you could take. They've given 150 to 200,000 infusions at the Reardon Clinic, and there's never been a significant adverse side effect. I mean, somebody might have some minor thing and it goes away. And out of 150 to 200,000 infusions, there's never been a kidney stone. This is just complete bunk. No known toxic dosage. The people that take the highest doses of vitamin C have the lowest incidence of kidney stones, not vice versa. And the higher the vitamin C levels in the blood, the lower the incidence of kidney stones. And the important thing to remember here is kidney stones are calcium oxalate. Now, vitamin C and many other things can produce oxalate, but oxalate by itself is harmless and quickly excreted in the urine. But if you have high levels of calcium available, then you're going to be prone toward kidney stones, because at least 85% of kidney stones are calcium oxalate. And it's the excess calcium that can make the presence of too much oxalate effectively toxic. And now, an important concept as we go into the last portions of this presentation. Let me recap. All disease is excess oxidation. All excess oxidation is caused only by toxins. So this begs a question. If excess oxidation is disease and only toxins cause this excess oxidation, then where are the primary and most overwhelmingly concerned toxin sources? Okay. I consider there to be three main toxic sources. I mean, there can be other toxins that'll get you sick, but in terms of the population of the world and the thing that causes most people to get sick and eventually die, come from three main toxic sources. I would say in developed countries, not countries that are starving and have extremely poor nutrition, but in developed countries where the people eat normally, These sources that I'm going to outline for you cause all disease due to this excess toxicity well over 95% of the time. So number one is pathogens. All pathogens, either an abscesses, colonization, or an infectious disease, all produce toxins, endotoxins, exotoxins. They all produce toxic metabolic byproducts. And very significantly, they all release very large amounts of reactive iron. Okay. Reactive iron is one of the most, if not the most potent pro-oxidant substance have in your body. So you never want more iron in your body than you need to make enough blood. Number two is accumulation of heavy metals. It's incredible and still not even minimally recognized how many people, especially those with heart disease, have enormous concentrations of mercury, lead, and antimony in their heart, especially mercury and especially antimony, which comes primarily from liquids, water, carbonated beverages in plastic bottles, because the plastic was made with antimony. And then finally, unfortunately but true, the presence of persistent spike protein. Now, spike protein is a toxin, okay? So that's why this is in this category. Spike protein is not only a toxin coming from long COVID, but fragments of spike protein. So even when you initially break it down and break it in fragments, many of those fragments are still toxic. So you need to have things to do that can completely eliminate spike protein from the body. And this is important because right now, after our pandemic, almost 6 years later now, we still have patients that are chronically ill with sick COVID, frequently getting turbo cancers, a high incidence of exotic cancers that we've not typically seen before. And this is all because of the spike protein. In the United States, there's probably about 20 million people, more or less, with long COVID, chronic COVID, persistent spike protein, and worldwide along the lines of 350 million. Those might even be low numbers because the diagnosis of long COVID is not being properly and vigorously pursued. A lot of times it just has minor non-specific symptoms, even though the spike protein is still wreaking havoc in the body and making the person prone toward blood clots, heart attacks, strokes, and cancers. So this means the promoters of all chronic disease are infections, all right? And of those infections, the overwhelming majority are dental. Chronic pathogen colonization, another big one. This is not an infection, but just an area like on a petri dish where the pathogens are just in a steady state. They're growing, but they're not multiplying enough to make a big mass like an abscess. And as they grow and as they keep going, they're mainly in the nose and throat. And what do you do all the time, every day, while you're sleeping, while you're awake, is you swallow. And so anything that these produce and metabolic toxic byproducts you swallow, it keeps the gut poisoned, where you have leaky gut syndrome and a horrible overgrowth of the microbiome. And that additionally becomes another toxic pathogen laden problem to go into all the tissues of the body. Known external toxins, heavy metals, toxic iron, I told you about that. Toxic calcium, I told you about. Dietary toxin exposures. It's important to remember that poor digestion is really worse than a poor quality nutrition in terms of toxic impact. So if you have a perfect diet, but digest it poorly, you're going to have more toxins generated in your gut than if you ate lousy food, but digested it perfectly. And finally, low sex hormone levels, especially subclinical low thyroid level, that's not usually detected on regular testing, low sex hormone levels, and low cortisol levels. I want to quickly say we're hearing a lot of silly stuff, well, maybe not silly, but inaccurate stuff about high cortisol causing so many problems. Well, the reason high cortisol causes problems is the reason the cortisol is high is because the body and the adrenal glands are trying in vain, unsuccessfully, to push vitamin C inside the cell that's not there. So people that don't supplement vitamin C are going to be much more prone toward high cortisol levels, because the cortisol is, if you will, not satisfied, and the adrenal gland is not satisfied if there's not vitamin C going into the cell, which will never happen if the vitamin C is not there to go in. And in fact, we have studies that show people with hypercortisolism, when they start taking vitamin C, the cortisol levels drop. So the principles are: prevent and minimize new daily toxins, neutralize toxins already present, excrete toxins in as non-toxic or minimally toxic a fashion as possible, because detoxification always causes some retoxification. When toxins come out of the tissues, 100% doesn't get excreted. Some unfortunately find their way back into new tissues. You need to resolve infections and chronic pathogen colonizations. Of course, you need to supplement optimally. And often ignored but extremely critical in just about treating anything is identifying and making sure critical hormone deficiencies have been addressed. The primary sources of pathogen-related toxins are in the mouth, root canals, chronic pathogen colonization, chronic gum disease, chronically infected tonsils. Now, we're going to go into why pathogens, and in the mouth, are almost the exclusive reason for having a heart attack, developing coronary artery disease, and having a heart attack. When you have infected teeth, tonsil, root canals, etc., especially in the molars, and you chew on them, what do? You push pathogens and toxins into two places: into the venous blood and into the draining lymphatics. So when you chew on an infected tooth, you effectively deliver toxins and pathogens into your system, into your body, more effectively than if you just gave them IV push with a syringe. So once these go into the veins, draining the teeth, the veins are low pressure. So they don't have any reason to settle into any artery because they're just floating along. Nothing is pushing them anywhere. But once the venous blood goes into the pulmonary circulation, which is still low pressure, and the pulmonary circulation comes down to the left atrium of the heart, which is low pressure, and then goes from the left atrium into the left ventricle, which is super high pressure. So from the left atrium, the left ventricle, very low pressure to very high pressure, and the first artery to receive this high pressure blood is the coronary artery. Gets nearly 25% of the cardiac output. And literally then, the toxins and pathogens actually get a physical pressing into the wall and begin the process of chronic pathogen colonization of the coronary arterial wall. When you drain the lymphatics, and I'll talk about this after I address the coronary arteries, those lymphatics drain into the breasts. Now, inflammation is now accepted as the primary cause of initiating and evolving atherosclerosis, and is considered to be a chronic inflammatory disease. The problem is, especially my fellow cardiologists, do not seem to care or know or realize that inflammation always comes from something else. So do they really think we're having an epidemic of coronary artery inflammation, or we're having an epidemic of something causing that inflammation? Well, what is inflammation? This is a very, very important slide. I encourage you to pay close attention. Inflamed cells and tissues are always vitamin C depleted. Inflammation always is present where oxidative stress exists. Vitamin C depletion is always present where oxidative stress exists. So when you have inflamed tissue, severe, you have a severe vitamin C depletion in that tissue. When you have mild inflammation, you have a mild vitamin C depletion. But bottom line in big print, a state of vitamin C depletion defines the state of inflammation. They're one and the same. Inflamed tissue is vitamin C depleted. and vitamin C depletion is in inflamed tissue. They describe the same process. Now, inflammation requires the presence of something that oxidizes. All right. The thing that we're just talking about that oxidizes the most are low-grade pathogen colonizations or gross infections. They produce a ton of pathogens, produce a ton of toxins, toxic metabolic byproducts. And what does that do? It just completely consumes all the vitamin C that would normally be present inside the arterial wall, keeping it healthy. And when the seeding does not stop, the inflammatory response becomes chronic, and then you get atherosclerosis. Now, also a very important slide. The only trigger for the acute immune response is the presence of inflammation. If you don't have any inflammation anywhere in your body, your immune system is just on standby, waiting for inflammation to develop somewhere, and then it can respond to the area, the cells, the tissues that's inflamed. Now, what is the first cell of the acute immune response to show up at the site of inflammation? It's the monocyte. What's inside the monocyte? The monocyte has 80-fold, 8,000% more vitamin C than in the blood. It's the most vitamin C mobile packed cell that you can have. Also, the monocyte contains a high concentration of hydrogen peroxide. Also, the monocyte contains a high content of magnesium. Well, I hope it's clear, and if not, let me state it. Inflammation is a state of severe vitamin C depletion, and the first cell that the immune system sends to that inflamed tissue is a cell packed full of vitamin C. The monocyte is a vitamin C delivery mechanism to try to bring the oxidative stress down, which it would do if the pathogens were eliminated. So if you stop oxidizing new and replace the vitamin C, you'll completely quell the inflammation. But you're still chewing on these infected teeth. You're releasing new pathogens in the blood every day. The pathogen colonization is chronic, so the response is chronic. Also, again, if there's no further infection coming in, what else does the monocyte do? It has magnesium that increases vitamin C uptake into the cells. That's great. And it also has hydrogen peroxide to help kill the pathogens. So it's a perfectly packaged immune cell to knock out acute inflammation secondary to a one-time pathogen infection. I say one time because if it's acute, the monocyte will resolve it completely. Now, if you're still getting pathogens in all the time, that's not going to happen. When the pathogens continue to come in, the immune response goes from acute to chronic. And the cells that start coming in then are less monocytes and more fibroblasts and other cells that build up tissue, that build fibrous tissue. Well, this is as much a hypothesis as anything else. If you have a better hypothesis, I encourage you to put it out there. But the fact of the matter is then the lack of vitamin C in the arterial wall severely reduces collagen and connective tissue strength in the wall. I mean, if you have no vitamin C in an area, it's very, very weak. It's very, and you need an artery, obviously, and a heart to be very strong. Because if it's not strong, it starts to dilate and then maybe form an aneurysm and then rupture. And obviously, nothing can be worse for your health than a ruptured coronary artery. You die immediately. Well, the body has multiple defense and compensatory mechanisms for just about any scenario. So what does the body do? What does the immune system do in the chronic immune response when bringing in vitamin C is not resolving the situation because the pathogen present is continuing to keep the vitamin C level low and the collagen level low and the connective tissue level low? What's the body supposed to do? Well, it has no vitamin C to bring in, and it can't resolve the vitamin C deficiency. So it has really one option. Let's make the wall thicker. So even if it's poor quality tissue, a thicker wall is going to be much less likely to rupture than a smaller wall devoid of collagen and connective tissue. And so this is how atherosclerosis and plaque develops, especially if the pathogen and toxin challenge from the mouth goes unaddressed. Then atherosclerosis continues to progress, trying to keep the blood vessel wall strong until, of course, it enlarges so much it blocks off the blood vessel. Chronic pathogen colonizations are virtually the entire reason for chronic inflammation. And look at this study. In 2006, they looked at 38 known coronary artery disease patients, known. They had plaque, and they did an atherectomy where they scraped the plaque out, and then they analyzed the plaque. In the plaque, they found greater than 50 different species of virus, bacteria, protozoa, and fungi. Over 90% of them had fungus as well, chronically present. Now, a normal coronary artery has none of this. So this is unique to the atheromas present in chronic coronary artery disease. And they only found it in 38 out of 38 patients, which I like to say is pretty close to 100%. Root canals, which are the infected, one species of infected tooth in your mouth. The oral pathogens are typical in the coronary atherosclerotic plaque that is found in root canals, and that's been established as well. In people that have heart attacks, they've had narrowings for a long time, and then finally they form a platelet clot, block off the blood vessel completely, heart attack. When they go in by angiography and suction out that soft platelet clot that did the final obliteration of the lumen, they found enormous amounts of infectious agents DNA, okay? And the total amount of this pathogen DNA inside the clots was 16 times higher, 1,600% higher than present in the surrounding blood. So that's a causative factor. You didn't block off the blood vessel, then suddenly pathogens come around. So this is further indication that when you do finally get a heart attack, it's because you've activated the platelets with the chronic infection in the atherosclerotic plaque until it finally blocks off. These same pathogens are seen. Remember, the first blood vessel is the coronary artery, then it goes on up into the neck and into the head. So root canal related bacteria were found in a majority of patients with ruptured and unruptured intracranial aneurysms. Also found in the pericardial fluid, the fluid surrounding the heart, post-mortem in coronary artery disease patients. And this is very important too. I'm not going to spend a lot of time, but I want to mention that, what did I say? Increased toxins, increased oxidative stress, which is the disease. Well, if you have a diseased tissue and there's no infection continuing to seed it, vitamin C and other antioxidants should cure it, but that doesn't happen. It doesn't happen because from the gut, from the leaky gut, from the mouth, in the blood, in the lymph, you see throughout the body areas of chronic pathogen colonization, which have been documented in these diseases. Alzheimer's disease, that's a Porphyromonas gingivalis, that's a classical oral pathogen. Cerebral thrombi, multiple sclerosis, cerebral spinal fluid. They haven't looked in that many different cases, but I guarantee you, whatever tissue they find that's chronically diseased, if they do sophisticated enough testing, they're going to find chronic pathogen colonization. The tonsils are really important. Dr. Isles found that 98% of his advanced cancer patients had between 2 and 10 dead teeth, which really meant root canals. And he also found, after he did his cancer treatment program, that 10 to 20% had heart attacks during the treatment program. And later on, quite brilliantly, concluded that even though they looked normal, the tonsils were chronically infected. So he started including tonsillectomy in his cancer treatment protocol, and lo and behold, no more heart attacks. And on pathology, he found 100% of the extracted tonsils appeared morphologically normal externally, but were extensively infected and abscessed on pathological examination after the extraction. So the tonsils are very weak immune organs. And when they're chronically draining a jawbone that has infected teeth in it and infected gums, they're going to get chronically infected. And even after you remove those teeth, they're going to stay chronically infected. So the protector becomes the infector, all right? Intratonsillar ozone injections can help resolve this, and also topical methylene blue on the tonsils can help resolve this. And interestingly enough, the same protocol, including direct ozone injection, can also quickly resolve acutely infected and enlarged tonsils, which is different from this, like in childhood tonsillitis that have tonsil stones and pockets of pus. If this is done, most kids wouldn't need the tonsillectomy that's being done so frequently these days, because you can resolve the infection in the tonsils, but it always needs help. Also, ozone insufflation. That's where you continue to put ozone in the ears. And also, very simple, very easy, putting and holding 3% hydrogen peroxide into the ear canal can also go a long way, because remember, the mouth, the throat, the nose, the ears, they're all connected. So it's pretty much never going to find one area that's pristine and the other areas that are infected. So a lot of these things are sustained by persistent colonizations in the middle ear and elsewhere in that area. So that's coronary artery disease. Now, the draining lymphatics and veins of the jaw and mandible make significant antioxidant depletion most likely to occur to the greatest degree of the head, neck, and chest. Well, not surprisingly, the lymphatic drainage of the neck, okay, the big site of drainage is the breasts. And once it goes through the breast, then it goes into the armpits and then out into the circulation. Now, this is important because all of the toxins drained in the lymph are going to be screened through the breast. And we have the studies that show very convincingly the high correlation between infected teeth and breast cancer. It's really almost inevitable unless you have very small breasts and you go to measures on a daily basis to wash out the old lymph. I mean, women laying flat on their back in bed at night before they go to sleep, doing a good breast massage can help get a lot of the stagnant lymph that has a lot of these pathogens in it out and screened and filtered in the lymph in the armpit and eventually purified to go into the blood. But that's not routinely the case with most ladies. Important point on cancer. All right. Again, I have to be concise here, but let me just tell you, cancer only originates where intracellular and extracellular oxidative stress is at its highest. And this is why chemotherapy does kill cancer cells, is because it increases the oxidative stress even higher to the point that you get cellular rupture. But the oxidative stress that's lower but associated with other chronic diseases is not going to cause cancer. You got to get that oxidative stress high. Now, what causes the highest levels of oxidative stress? Pathogens. Pathogens have been consistently isolated and grown from cancer cells themselves, as well as from the extracellular space surrounding them. Look at this list. Pathogens have been consistently found in culture from these cancers: oral, head and neck, esophageal, liver, prostate, pancreatic, colorectal. In normal breast tissue, researchers have found tenfold, 1,000% more bacteria in breast tumors relative to breast. So I misstated that. Relative to a normal breast, in breast tumors, there's 1,000% more bacteria present. And many of them are pathogenic. Pathogenic means something that causes a lot of oxidative stress. A regular microorganism can be beneficial if it doesn't have a pathological metabolism producing a lot of toxins. But the microbes found in breast cancer are aggressive, invasive pathogen species that have been documented to be the causes of malignant transformation. So with the very rarest of exceptions, cancer, especially breast cancer and coronary artery disease, never arise in the absence of on-site massive increases of oxidative stress from indwelling pathogens of oral cavity origin. And let me just quickly say, in terms of public health, coronary artery disease and breast cancer, again, outside of things like starvation and other things not directly related, kill over 50% of people that die. Okay, so, and that's why I isolated these two things. Obviously, I would hope, obviously, you can see that everything I'm talking about in the mouth and pathogens and all can cause problems throughout the body, can cause chronic diseases throughout the body, but they've been documented to be the primary factors in having a heart attack and having breast cancer. So a treatment plan should never avoid removing root canals and other infected teeth. Got to be done. You got to have proper diagnosis of cone beam computed tomography or the 3D x-ray to properly identify areas that are infected. Many teeth that are asymptomatic and never been root canal have abscesses, and those need to come out as well. And if you don't do that, as my wonderful mentor, Dr. Huggins, told me 30, 35 years ago, he said, Tom, I said, yes, sir. He said, you can't dry off while you're still in the shower. So just dealing with areas that have already been damaged or infected or oxidized does you no good, or does you not much good, if you don't address the new daily toxin, usually from pathogens, coming in. So both. You need to prevent and resolve, and you need to repair. You need to do both. Periodontal gum disease, it's really what causes teeth to get infected. And it features the same array of pathogens and toxins. And a very important thing, I mean, there's a lot of protocols I can go into that affect different things, but I want to leave you with a couple of simple things that can be done that can strongly prevent nearly all disease and be a major factor in resolving locked-in disease. And that's when you address focal infection and chronic pathogen colonization. So this means that getting good gum care, all the problems in the mouth start with infected gums, unless you have trauma to the mouth. Infected gums are almost completely, routinely, completely normalized with water picking containing hydrogen peroxide. It knocks out the pathogens, and it's the pathogens that cause inflammation. It's the pathogens that go down and then retrograde, come up into the tooth and cause an abscessed tooth. So that's number one. Number two is hydrogen peroxide nebulization to help deal with the pathogens that already got colonized. So periodically just doing those simple things. Hydrogen water picking or water irrigation with hydrogen peroxide in the solution, not pure hydrogen peroxide, and chronic pathogen colonization, hydrogen peroxide nebulization. You'll do yourself an enormous amount of good, and you'll find abnormal guts normalizing, because in the end you stop swallowing all that stuff. You stop presenting the gut with new oxidative stress on a daily basis, and you would be amazed how quickly the gut can heal itself. Periodontal disease, because of this, has been linked to everything. And I say linked because that's what they say in the literature, but really it's cause and effect. Increase all-cause mortality. Increase all-cause mortality, coronary disease, diabetes, high blood pressure. You look at the list. Brain, pulmonary, arthritis, inflammatory disease, lupus, all the major neurologic diseases, all the major cancers. Why? Well, I just said pathogens cause the most oxidative stress. All these tissues start colonizing pathogens. Pathogens have been identified, as I told you, by biopsy, inside cancer cells and surrounding cancer cells. You're never going to find, really, for all intents and purposes, an area of astronomical cancer-causing levels of oxidative stress without the presence of pathogens on site. This is the regimen I told you about for dealing with the periodontal disease. I mean, you can resolve advanced periodontal disease, awful-looking gums, in a few weeks to a month by doing this. And they grow back big, beautiful gums that you think can't possibly be ever occur again. But when you take away the infection, the gums regenerate very well. I tell people not to floss, okay? That does a poor job of getting contamination out. It's not any way to clean the tooth. You don't clean dirty hands by scraping them. You clean your hands with water and an agent like soap. So, and it doesn't do anything at all for the pathogens that are sitting there in the gum. It just flicks out areas of food and food debris. Now, I'm not saying flossing per se is horrible, but it's not getting the job done that you want to get done. It's because you want to get the pathogens out of the gum, not just loose or impacted food particles. And then, as I said before, with the hydrogen peroxide when you start getting normal, healthy gums again, and you have not yet developed infected teeth or a root canal, you keep the gums healthy. Believe me, this is the start of the sequence. If you keep healthy gums and have not yet had any teeth infected as a result, you're way, way, way ahead of the game in being healthy throughout your body because of all these interactions between the mouth, pathogens in the nose and throat, and pathogens in the gut. Chronic pathogen colonization generally stays there forever unless you interrupt it, okay, because of biofilms. These are most commonly present in this list of things: sinuses, the throat, the tonsils, inside the proximal part of the lungs, the tongue, a major source of chronic pathogens, and even the esophagus itself. As I mentioned, hydrogen peroxide knocks out these biofilms and knocks out the chronic pathogen. Hydrogen peroxide nebulization, a perfect and very important adjunctive process to the water picking with water or something else, some solution containing hydrogen peroxide. So, tongue hygiene, got to scrape it. So let me give you the recap. Number one, all disease is excess oxidation and not a further condition caused by it. Resolving the excess oxidation resolves the disease. Number two, toxins are the sole only reason for excess oxidation. Number three, vitamin C is the foundational, critical, pivotal antioxidant in the body. And when you're able to get normal levels of vitamin C inside cells, you no longer have a disease cell and the cell is normal. Number four, chronic infection with pathogen colonization is the primary source of disease-causing toxins. Also, as I mentioned, accumulated heavy metals and persistent spike protein can be critical sources in other patients. And finally, listen to this statement. Oral cavity infections account for most conditions resulting in fatality across the planet. This is my website. This is my email. I can't do consults, but I can often lead you to good information. Thank you.